Decongex Plus Oral Solution contains brompheniramine, brompheniramine maleate, and phenylephrine as active ingredients. Decongex Plus Oral Solution is used for hay fever, other allergies, cold, hypotensive conditions, nasal decongestant, mydriasis, intraocular tension, rhinorrhea, sneezing, lacrimation, and other conditions. Decongex Plus Oral Solution works by blocking the action of histamine. Constricting the blood vessels results in decreasing the flow of blood. This relieves nasal congestion, inhibiting the effect of histamine on muscles. Uses: Decongex Plus Oral Solution is used for the treatment, control, prevention, improvement of the following diseases, conditions, and symptoms: hay fever, other allergies, cold, hypotensive conditions, nasal decongestant, mydriasis, intraocular tension, rhinorrhea, sneezing, lacrimation. How to use: Decongex administers the recommended dose every 12 hours. Adults and children over 12 years of age, 5 to 10 ml, 1 to 2 teaspoonfuls. Children 6 to 12 years of age, 5 ml, 1 teaspoonful. Children under 6 years of age, consult a physician. Contraindications: Hypersensitivity to Decongex Plus Oral Solution is a contraindication. In addition, Decongex Plus Oral Solution should not be used if you have the following conditions: allergic, asthma attack, hyperthyroidism, narrow-angle glaucoma, stomach ulcer, unable to urinate, asthma, premature or full-term neonates, self-medication in children younger than 6 years of age. Precautions: Because of its antihistamine component, Decongex Plus should be used with caution in patients with a history of bronchial asthma, narrow-angle glaucoma, gastrointestinal obstruction, or urinary bladder neck obstruction. Especially in infants and small children, antihistamines in overdosage may cause hallucinations, convulsions, and death. Antihistamines may diminish mental alertness. In the young child, they may produce excitation. Side effects: The following is a list of possible side effects that may occur from all constituting ingredients of Decongex Plus Oral Solution. This is not a comprehensive list. These side effects are possible but do not always occur. Some of the side effects may be rare but serious. Consult a doctor if you observe any of the following side effects, especially if they do not go away: dizziness, drowsiness, dry mouth, throat and nose, thickening of mucus in nose or throat, restlessness, difficulty in passing urine, headache, swelling of the face, slow heart action, difficulty in breathing, red skin rash, high blood pressure, urge to vomit, hypertension.